This is a Dutch testing report tutorial that's intended to help you with the understanding of your test results. These are for educational information only, not for medical advice. So we're going to look at the cortisol results. The results that we actually show on the screen are not your own. They're not your patients. They're just to help with the conversation. So there's a lot of data as we're looking through the cortisol. But we want to focus most importantly on the free cortisol pattern. So we've got 4 measurements throughout the day. We've got a waking sample that reflects not your cortisol when you wake up, it's urine when you wake up, which reflects the cortisol throughout the night. And then those next 2 hours, the cortisol is usually at its highest. So we want to look for that surge of cortisol in that sample that's collected 2 hours after waking. The results typically will drop down quite a bit by afternoon and then are at their lowest usually around bedtime. So you'll want to look at your patient's results at each of these individual points, looking for dysfunction in that up and down pattern of cortisol. Then we add those 4 up, and for this particular patient, we're on the higher side of normal, yet within the range, for the total of free cortisol. Okay, so that's a picture of your overall circulating free bioavailable cortisol. So again, we're looking for dysfunction in the pattern. We've got the total here. We know it's high normal. So, but as we ask ourselves, how much cortisol is actually being produced, we know that the free cortisol is only about 1% of the total. So that's not a good marker for production of cortisol. The metabolized cortisol is your best marker for total cortisol production, and in this case, it's elevated. So as we look at a free cortisol that's somewhat elevated, the total cortisol production is confirmed to be not only a little high, but it's outside the range. There's a lot of cortisol production for this particular patient. So as cortisol is made, it circulates as cortisol, but it also circulates as cortisone. And there's a back and forth action between the two that's mediated by an enzyme called 11-beta-HSD. So because cortisol spends a lot of its time in its inactive form, when we're looking for that up and down pattern, we also can confirm that by looking at the inactive cortisone. It's of secondary importance, but it's a good bit of information to look at as well. Then both the cortisol and cortisone are metabolized to cortisol and cortisone metabolites, and when you add those all up, we call that metabolized cortisol, and that's your marker for total cortisol production. Again, in this particular case, that's elevated. So if the free cortisol is within the normal range and the production of cortisol is actually elevated, the metabolites are actually elevated, depending on the degree of difference between the two, that could imply that there is upregulated or increased cortisol clearance, meaning it's getting cleared faster than it normally does. So what does that? Obesity, we see that. High thyroid, long-term exposure to elevated cortisol levels may increase the rate at which the body processes cortisol. So, and we may see that in this case. You may see other cases where you've got just the opposite, where, if the free cortisol is high normal and the metabolites are low, that implies low or sluggish cortisol metabolism, and you'll see that in low thyroid, poor liver function, that sort of thing. So we've got high normal with respect to the total cortisol. We've got elevated overall production, glandular output of cortisol. And then you may want to ask the question, okay, well, which one's really predominating here? The cortisol or the inactive cortisone? And it's tempting to take that information from the measurement of free cortisone and free cortisol. But the scientific literature would suggest that it's those downstream metabolites of cortisol and cortisone which best reflect systemic overall preference for active cortisol or inactive cortisone. So in a case like this, where you've got fairly elevated free cortisol and you've got elevated cortisol production, if this is pointing towards cortisol, then you've got a metabolic preference for keeping all that cortisol that you have in its active form, which may exacerbate symptoms that are related to high cortisol. If, on the other hand, and this may be more common in a case like this, you've got a preference for cortisone, that may be an indication of a compensatory type mechanism, meaning the body's seeing all this cortisol and it's got to get rid of it, pushing it towards cortisone, which may also explain in a case like this why the cortisol is fairly normal even though the production is elevated, that a lot of that is getting shuttled over towards cortisone to get rid of some of that cortisol. So you want to piece the whole thing together. Free cortisol over time, the total of production, and then any metabolic preference that there may be. If you have other questions from a patient perspective, please see your healthcare provider with any questions on what this test might mean. If you have other questions on the testing in general, we have many more educational videos at DutchTest.com, and we thank you for testing with us.